So, Krisela, tell me a
Yes.
little bit about your journey up to now in terms of your professional life.
I really wanted to become a doctor. Even as a child, I wanted to become a doctor, and I wanted to make sick people well. And that's what I did. I took my pre-med at the university, but eventually became more interested in nursing. And I was able to use my nursing background in what I do now, which is to serve communities as a public servant. So that was a big change for me, from nursing to being in politics. But what I've learned as a nurse, my background in public health has been very, very instrumental in what I do now. The decisions I make and the way I approach my constituents. But you too had a big change in your profession.
I
Yes,
did.
Angela?
I did. I was sharing earlier that I loved treating patients. But I realized as I looked at more and more patients that there was so much to be done before people entered the hospital.
Right.
And so I made that shift from an oral surgeon to public health. And I love the whole possibilities, right? Possibilities of prevention, possibilities through promotion, possibilities through business, through design, through communication.
Right.
So I love that whole aspect of public health. And to think that, you know, I would prevent a lot of people from going into hospitals or being sick just made me feel makes me feel really happy and hopeful.
Giving them more control over their lives.
Yeah.
Because if you're in the hospital setting, you're at the mercy of the health professionals.
Yeah.
But if it's preventive and you teach them how to not get sick,
Right.
then you give the power back to them.
Krisela, tell me some more about why you decided to enter into politics and what you're doing now, and how the health background is influencing some of your decisions.
Yeah,
I'm so
I have to be
curious.
honest. My father is in politics, and he has a very strong influence over the family. But I never wanted to be in politics. So when I migrated to the U.S., left the Philippines, got married there, he was the one who came to me and asked me if I were interested to get into politics. And I said, for one condition, I'm going to try to be a village chief first. So my first elective post was a village chief.
Wow.
I was 27 years old.
Wow.
Yes, no children yet. Brought my husband back to the Philippines and then worked as a village chief. A village chief was all three, an executive, had the legislative, so made policies, at the same time, judicial.
Wow.
So it was a big, change for me, and I loved it. I really loved it. So if my father encouraged me to be in politics, what really made me decide to enter was my experience
Right.
in the community. And I was able to use the lenses of a nurse, taking care not only of individual patients, but the community, the family as my client. So it was very effective. More nurturing. I agree with you. Prevention really is better than any cure. And we can really strengthen individuals, families, and communities if we impart on them how to not get sick.
And now you're the mayor.
Now I'm the mayor, yes. I'm the mayor. But before I became mayor, I became a legislator first.
Right.
A member of Congress, I think,
Right.
Parliament here.
Right.
Yeah. So I was a policymaker, and most of the laws that I was able to pass and espouse were my advocacies: gender, health, education. So human rights.
Right.
So it's more of the softer side.
Right.
Softer side.
Would you say that your background in nursing pushed you towards these direction? Is that something you saw?
I think so. A great influence also. And there's a great need too. And I think the need for reproductive health
Right.
it was a big need. So among the first measures that I espoused was a comprehensive reproductive health program
Right.
in the Philippines. It took 13 years to pass. 13 long
13
years.
yes.
It didn't happen during
But
my
a big
term.
achievement. Yeah.
It was a big achievement, yeah, especially for
Yeah.
women. And now I get to implement it.
Right.
Yeah.
Tell me some. I've always been interested in women decisions that are made when women are in leadership positions, women in politics, and even more interested when they're women with health backgrounds in leadership position. So talk me through some of the. If you were not the mayor and someone else was without a health background, what might the differences be? Do you think?
Let's just take this pandemic for as a good example. My exposure as a health professional made it easier for me to understand COVID, and I was able to get the major things that I needed to teach people about it. If I didn't have that kind of background, most probably I will not be focusing on nutrition and strengthening the immune system. I would not be focusing on what's going to happen to education while everyone is at home. You know, I would be focusing on buildings,
Right.
you know, building quarantine facilities, making sure that there are enough vehicles to transport the commodities and that sort of thing. I focus on livelihoods.
Right.
I focused on education, distance education, alternative modes of providing education to our children. So definitely making the immune system stronger. You know, that sort of
that
thing.
tells me that you're communicating and focusing on hope and resilience.
Yes, yes, hope,
Yes.
resilience, and empowering people. Because with COVID, we sort of surrendered,
Yeah.
you know, and said, I don't understand this, I give up.
Yeah.
And you tend to export fear and
Yeah.
more fear, especially through social media.
Yeah.
Many of us did not understand, and what we do not understand, we are fearful
We're
of. Yeah, and that's what we export. And so rather than exporting fear, I think we should export hope.
Yeah.
You know, that things will be okay. This is what we can do now. These are the things that we cannot do, so do not spend much time there.
Right.
Focus on what you can do. We can make our resistance stronger. We can prevent it from infecting our families. How? This, and this.
Do you think that, so there seems to be a lot of fear around climate, fear around, and a bit of hopelessness. Oh, it's just getting warmer, there's going to be floods, there's going to be this. And what you said is right. I think people can build resilience if they have hope, and if you communicate hope in a proper way.
Right.
And I'm sensing that if the leaders have some amount of health background, but also are able to communicate properly.
It's a continuum.
Yeah.
Health, environment, it's a continuum. You cannot but talk about environment when you
Right.
talk about health,
Right.
or health without talking about the environment would
Yeah.
be useless. So, yeah,
But
definitely.
we're heading for difficult times.
Yes,
And you're
yeah.
in politics. So what can you tell me when I work with people who live in climatically, sort of dangerous or fragile areas? What can I take? And you're from the Philippines. You'll have
And
typhoons.
you've been to the Philippines,
Yeah.
and you've been to our part of
Yes.
the Philippines.
Yes.
We face the Pacific Ocean. We are
Yeah.
frequented by
Yeah.
really big typhoons. During the height of the 2020
Right.
pandemic, we were hit
Right.
by the strongest typhoon
Yeah,
ever
well.
to hit our place, Typhoon Rolly. So how do you manage
Yeah.
the pandemic and then 50% of
Yeah.
your structures,
Yeah.
you
Yeah.
know, just washed out? And we have the active volcano,
Yeah.
the
Yes.
most active volcano. So talk about resiliency.
Yeah.
I think it is part of our genetic makeup, you know, in our part, but you just have to catalyze still.
Yeah.
You know, it might be there, but you just have to ignite it again. I'm not saying that that's home for us, Angela.
Yeah.
We cannot
Yeah, you
go
can't do it.
anywhere. That's our home. What we can do is just build more resistance.
Yeah, resistance and resilience, community resilience.
Yes.
Yeah.
So don't live in areas where it's
know.
always, being hit. You
Yeah.
know, that's why I'm big on resettlement. Okay, we resettle homes and communities, and we build new communities with complete facilities. So that's what we do. But it's the same place.
Right.
We invest on land banking, which means you can now transfer, the communities from dangerous areas
Right.
to, safer areas.
In all of this, I think what I'm hearing you say, and it's resonating with some of the work that we're doing, is that when we work with communities in chronic crisis, one of the biggest tool is the creation of hope, and emotional health and emotional resilience. Because in my journey in public health, the health system's response is always treat the infection, treat the chronic condition, manage the chronic conditions.
Yes.
But we oftentimes forget the whole emotional aspect of everything, of everyday troubles. And I think particularly for those who live in crisis areas or who are poor, they have everyday tiny crisis. And so even if I've managed to, manage that person's diabetes or, made mobility issues go away, I think if I don't work on hope and emotional resilience and just joy and happiness, I wouldn't be able to achieve that healthy day. So my organization, Swasti, just entered its new strategic plan, and we've set our North Star metric called Healthy Day. And Healthy Day has been around for a while. CDC's.
What is Healthy Day?
Yeah, so CDC's made it, European Union's made it. A healthy day is when there's a very simple, globally validated tool, but it answers questions like how capable do I feel of taking care of myself? How capable do I feel of taking care of my family? What is my social relationship about? Am I able to navigate it and on top of it? And in general, am I hopeful, joyous? So
there's like a tool to
there is a tool. And
okay.
so I can have my diabetes managed, I can have my hypertension managed, I may not be in any pain, but I still could feel hopeless, which means I haven't done the job. And so we're encouraging our team to look at a person feeling hopeful and strong and positive in as many days in a week as possible, because you can't recall more than 7 days. And therefore look at because if I feel hopeful and I have more healthy days, I will take care of my own health. I don't need a clinic to chase after me if I've taken my medicines. It's the other way around. And back in the day, you were talking about, staying away from the volcano. For me, the volcano that we have here some time ago was HIV. And the traditional HIV programs were, let's just distribute condoms. But when we spoke with the women who were practicing sex work, we sat together and said, hey, what are your priorities? Health wasn't one of them. It was safety from violence. It was dignity. It was safety for their children. And it was basic food and shelter. Now, if we took care of those things, if we said, hey, you're not surviving, but you will thrive. You do have a future. This is how you save money. This is what you do for nutrition. This is how we can create a system where you are safe and not being exploited by the cops or criminals on the road. Few years down the line, when we did this, life skills and systems building, we had a stock out of condoms because the women were asking for the condoms.
Okay, so you
and
created
they were
a
using,
demand.
We created a demand.
After you have settled
yes.
all the
we created
other
hope.
issues first,
We essentially created hope. And the women were like, hey, we have hope, we have a life, we have a future.
That's
I will
why
now protect myself.
I'm now going to invest in my health.
Yes.
Yeah.
So that's the journey, and I think we don't need to spend another 15 years doing that, but I think sharing these stories so that I guess public health agencies, be they government or private or civil society, can bring that in. I really want the health system response to not be a health system response, but be a more of a people holistic.
It's a more holistic
Yeah,
response. But does your organization train counselors?
Yes.
Because we have
yes.
very few psychiatrists or even psychologists in the Philippines.
No, same. I think there's a shortage of mental health
Shortage, really.
professionals, but there are fabulous organizations in India that train lay people, like non-qualified people, to be coaches and counselors. And I think that's in Africa, they have a program that brings grandmothers as counselors, and I think they can be fabulous counselors if they're tapped, their untapped potential. You know, elderly people are always, most of them are very nurturing, and they have time. And so
they need to feel that they're still needed.
Yes, absolutely.
There's still purpose.
Yeah.
You know, and so we're also allowing them to, you know, have better mental and emotional health. So actually, it goes both ways. If you share hope, you know, you also reinforce that hope within you.
Yeah, absolutely.
So you'll never get enough. You know, because it's always there. It will stay with you.
Krisela, what's your next step? From mayor to where are you going?
This is my last term.
Okay.
So there are term limits in the Philippines. So after serving for 9 years, come 2025, I want to try policy making again. And this time, more mature, more experienced, especially the grassroots, you know, experience, and more attuned with myself. I think that's very important. So I was a member of a Congress when I was 29 years old. And I will be 57 in 2025. So it means that I'll take a shot. You know, in responding to the need for better legislation.
Oh, that's excellent.
That can be implemented, not just on paper, but can be implemented at the local level.
So you're going right up to Congress.
Yes, yes, ma'am. Yes, ma'am.
All the very best, and you have the support of
if
your
we can just
community.
legislate hope.
Yes, if you can just legislate hope.
Yes, but I don't think it needs legislation. You just need more people sharing it.
Absolutely.
Yeah.
I wish you all the best. I would love to see powerful women leaders, particularly with a health background, go to the highest level. That's what protects our countries and gives us hope.
Yes.
Thank you so much for talking to me.
So continue being a catalyst of hope.
Thank you.
Angela.
Thank you.